Here's what these 8 random pains in your body actually mean. As we get older, the pains in our body begin to increase. You know what pains I'm talking about. It's the ones that come and go in a matter of minutes, but sometimes those pains begin to linger for an hour or two, but will completely disappear the following day, only to return a few days later. It can be frustrating, and while these pains may feel random, they're actually not. There is a reason behind every ache that our body has. Sometimes it can be cause for concern, and other times it's just wear and tear on the body. In order to treat and care these aches and pains, it is a good idea to be able to decipher why these aches and pains are occurring. It is always in your best interest to seek out professional help if you are experiencing random pains in your body. Never ignore any unusual symptom you experience. Talk to a medical professional first to find out what may be causing your unusual symptom. Now, let's find out the most common pains in your body and what they actually mean. Number 1. Pain on the bottom of your foot. According to the Mayo Clinic, the most common causes for pain on the bottom of your foot are injury, overuse, and any conditions that may cause inflammation that involves any of the bones, tendons, or ligaments. For example, runners who train for long-distance races may experience pain in their feet after training for extended periods of time. This pain is usually a result of overtraining, and if ignored, can lead to fractures or even breaks. So for those who are training for races and triathlons, you need to give your feet a break once in a while. Pain on the bottom of your foot usually begins as a stress fracture. Stress fractures occur when stress is put on the foot over a long period of time. If the foot does not rest, and if continuous stress is placed on it, the fracture can turn into a full-on break. The most common types of symptoms associated with stress fractures in the foot is pain at the bottom of the foot or pain in the ankle. Some people mistake stress fractures for sprained ankles and usually avoid going to the doctor because they think the sprain will heal in a few days. This is one of the biggest mistakes someone can make, as oftentimes the fracture will get even worse without proper treatment, leading to a possible break, and more time that the foot will require to rest. If someone is an athlete, this is a huge blow. Stress fractures can be put into 2 categories: low risk and high risk. Low risk stress fractures usually heal on their own as long as they are rested. High risk stress fractures, on the other hand, are known to heal poorly and often require an air cast or crutches. If you are an athlete and begin to experience any type of pain on the bottom of your foot and are having trouble walking, you should visit your doctor immediately for an X-ray to check if you have a fracture. Number 2. Buckling. When your knee buckles at a very young age, it is usually not that serious. But as you get older, your knees can become significantly weaker. So when it buckles, it's usually not a good sign. Healthline states that the number 1 cause for your knee buckling is an injury. They add that many cases of knee instability are caused by injuries from high-impact activities such as running. The most common injuries are ACL tears and meniscus tears. Inflammation fills your joints and will often affect the knees. Knee buckling is a common form of osteoarthritis and rheumatoid arthritis. Number 3. Pain in the back of the ear. It can be difficult to identify what is causing your headache, but if you have a persistent pain in the back of your ear, it can be a number of things according to Healthline. One of the reasons could be that you have a pinched nerve in your neck. You can get pinched nerves in your neck if you keep it bent for a long period of time. Another reason you might be having pain in the back of your ear is dental problems. Healthline explains that if you have an abscessed tooth or other dental issues, it can cause pain behind the ear. Have you experienced any of the random body pains in this video so far? Keep watching for some even more weird body pains that some of us might experience. Number 4. Sharp pain in your head. WebMD states that if you are experiencing a sharp pain in your head at least a few times a month, it could be occipital neuralgia. This condition occurs when the nerves that are running from the spinal cord to the scalp become inflamed. You will either feel pain on the back of your head or on the base of your skull. Occipital neuralgia is a very distinctive headache which causes piercing, throbbing, and chronic pain in the back of a person's head, behind the ears, or the upper neck. It can also occur on one side of a person's head. This type of headache usually begins in a person's neck and eventually spreads upwards. Other symptoms associated with occipital neuralgia include aching or burning pain in the head or neck, pain behind the eye, a tender scalp, sensitivity to light, and more. These types of headaches occur due to the pressure which is placed on the occipital nerves. This can be caused by injury, tight muscles, or even inflammation. Number 5. Muscle cramp. There are a couple reasons why you might have a muscle cramp according to Mayo Clinic. The first reason is inadequate blood supply. Your arteries become narrow, and you could feel muscle cramps in your legs and feet while you are exercising. The second reason is nerve compression. If the nerves in your spine are compressed, you may feel cramp-like pain in your legs. Number 6. Sharp stomach pain. There are many different causes for stomach pain. If you experience this pain once in a while, Medical News Today states that it could just be acid reflux. They add that if you experience this pain a couple of times a day, it could be a stomach or peptic ulcer. Sharp abdominal pain can be caused by many different types of conditions. Some of the main causes of abdominal pain include infection, inflammation, obstruction, abnormal growths, or even intestinal disorders. If you begin to notice sharp and/or unusual stomach pains that lasts more than a few days, you should go to the emergency room or speak to your doctor to find out what may be causing your stomach pain. Number 7. Leg pain. The arteries in your legs can become damaged and narrowed, just like the arteries that are connected to your heart. If this happens, you can experience lower leg pain when you're walking, climbing the stairs, or any kind of exercise, says WebMD. This is called peripheral arterial disease. If you start feeling these symptoms, it does not necessarily mean that you have this disease, but it does indicate that you should go speak to a doctor and get a proper diagnosis. Number 8. Sudden back pain. The first cause for sudden back pain is an injury. If you are exercising or overexerting your back, you increase the chances of pulling a muscle or straining it, according to WebMD. But if you have constant stress or poor posture, it can eventually lead to back spasms and chronic aching. WebMD adds that there's pressure on the spine, which can result from a herniated disc. It can also cause sudden back pain. If you experience sudden random bursts of pain in your body that you have never experienced before, and if this pain lasts for extended periods of time, you should absolutely visit your doctor to find out what may be causing your pain. Most people will resort to asking Google or strangers on the internet what their pain symptoms mean, but it's in your best interest to speak with a professional who can go over your medical history, perform the necessary tests and/or examinations, and determine what is causing your health issues or pain. Whether it is a sudden pain in your leg or stomach, or a swollen or painful foot, you should always speak to a professional when seeking medical advice. If you are an athlete and experience random pain, you should never continue to overwork yourself, as this can result in injury and make your condition even worse. In fact, Continuing to train while experiencing an injury is never a good idea. If the injury becomes bad enough, it may mean that you cannot compete until your injury heals. This can take as long as 6 months, so it's better not to risk it, and always speak to a doctor if you suspect that you have an injury. What other random body pains do you experience that weren't in this video? Let us know in the comment section below.